Hey, this is Mark Sachs, the program director at the Crozer Chester Medical Center Emergency Medicine Residency Program, and I want to thank you for your interest in our program. Unfortunately, with COVID, we're not able to meet and speak in person, but I hope that by watching this, you'll get some insight into our program, into our faculty, our residents, and our medical center. So we are located in southeastern Pennsylvania, just south of Philadelphia, and we're a large community hospital. We have about 300 inpatient beds and more than 15 different residency and fellowship programs, everything from internal medicine to general surgery, OBGYN, podiatry, pediatrics, as well as an ultrasound fellowship, sports medicine fellowship, geriatrics and vascular surgery fellowships, etc. So we're a very large, busy academic community hospital. We're the only trauma center in the area. We have a very diverse trauma population. We have some inner city communities nearby. We're located adjacent to main highways and railroad tracks, and a very large catchment area for trauma. We're also one of only 2 burn centers in the area, so we have burn patients that travel to us from across southeastern Pennsylvania, but also New Jersey, Delaware, the eastern shore of Maryland. We're part of Crozer Health, which is the largest health system in the area. We have 4 acute care hospitals, an inpatient psychiatric hospital, and then many, many outpatient offices, urgent care centers, and surgery center locations. The vast majority of your training will happen at Crozer Chester Medical Center, but you will spend some time at other hospitals, such as our community emergency medicine rotations at Taylor Hospital and Delaware County Hospital, and you may go to some of the surgery centers and urgent care centers as part of your training as well. As I mentioned, our hospital is in southeastern Pennsylvania. This you can see in this picture, kind of looking towards the Delaware River and New Jersey with the Commodore Barry Bridge. And you can see the community of Chester just behind the highway I-95, which runs right outside of our hospital. Our pediatric partner is DuPont, which is located in Delaware, just about 15 miles south of us. It's a state-of-the-art quaternary care pediatric hospital with all kinds of specialty and subspecialty services available. As a resident, you'll rotate there in the emergency department in your first year as well as in your third year, and you'll be in the pediatric ICU during your second year. You'll work alongside the pediatrics residents as well as the PEM fellows and pediatric ICU fellows. And what I'm really excited about is that our relationship with DuPont is a true partnership. While you'll go down there for some of your training, their fellows also come up to our emergency department for some of their training. So you'll work with them down there on your rotations, and when they're at Crozer for their ultrasound and EMS and emergency medicine rotations, you'll work with them as well. I should point out that Crozer is unique because we see pediatric patients all the time. Every shift you work, you'll see pediatric patients. You'll get pediatric trauma patients, pediatric burn patients, very sick medical patients, and you'll also be able to appreciate the seasonality of pediatric emergency medicine during the course of the year. Delaware County Memorial Hospital is the site of a community emergency medicine rotation. This is a tertiary care hospital about 8 miles away from Crozer. It has a very high patient acuity, but a slightly different patient population than you'll see at Crozer. There's also somewhat fewer services available. For instance, there's no trauma service, no stroke service, and so it's a little bit different scope of practice at Delaware County as compared to Crozer. You will work with the same attendings, the same EMR, within the same system, so there'll be a lot of comfort and familiarity by being there, but a little bit different scope of practice, a little bit different patient population, and sort of more of a community feel than when you're at Crozer, with which has many more services and available. Taylor Hospital is more of a true community hospital. This is where you'll learn some bread and butter emergency medicine. Again, it's the same faculty, the same EMR, but a little bit different services available there. For instance, you'll get some experience working with scribes while you're at Taylor Hospital. This is a place that has a very strong community buy-in. There's a real esprit de corps when you're working at Taylor Hospital. However, there are fewer services available, and there's a larger number of patients that may need to be stabilized and transfer. And so by working there, you'll figure out and learn a little bit more about that process, when it's appropriate to transfer people, when it's not appropriate to transfer people, and what is necessary to make that process happen. The mission of all of our departments is to deliver the highest quality emergency care to our patients, regardless of their gender, race, religion, or financial status. We really strive to create an atmosphere of clinical excellence and scholarship. And really, we're dedicated to developing compassionate physicians who will become lifelong learners and leaders, both in emergency medicine, but also in their communities. And the communities piece is very important to us at Crozer. Our hospitals are community hospitals. The folks that work there live in the community and have a very strong association to the community. And vice versa. The community has a very strong appreciation and feeling about our hospitals, and so we're really connected to the communities that we're located in. And one of the really heartening things about the development of our residency program is how well the residents have become integrated in the community, have become citizens not just of the hospital, but of the wider area that surrounds the hospital. The goals of the department are to teach you to recognize and treat acute illness and injury. And we have outstanding patient volumes, outstanding patient acuities, a real diversity of presentations and problems. And if you can work at Crozer, you will be well trained to work anywhere in the country. You'll be able to slide easily into any clinical setting. And we're really proud of that fact. You'll do research, you'll do scholarship. For the type of program we are, we do a tremendous amount of research and scholarship, and really have some great folks working on a number of different areas. You'll get experience in ultrasound, in EMS, in pediatric emergency medicine, as I discussed earlier. We have a sports medicine fellowship within the program, as well as an ultrasound fellowship within the program. And you'll get great experience on toxicology, on open access, medical education, etc. When we set up the curriculum, we really had the overall guiding philosophy that emergency medicine residents are best trained by emergency medicine specialists. And so the vast majority of your training will happen in the emergency care setting. We do supplement that with some ICU rotations, trauma rotations, but really all of the rotations are chosen to specifically provide you skills and experiences that will serve you well during your career in emergency medicine. And so our curriculum is really very heavily focused on emergency medicine. For instance, in the PGY 1 year, you'll do 8 rotations in emergency medicine, 6 in EM at Crozer, as well as a month of PDM and a month of community emergency medicine. We have an orientation period where you'll get some of your certificates like ACLS and PALS and ATLS. We have an anesthesia and ultrasound rotation, a medical ICU rotation, and an OBGYN rotation. In the PGY 2 year, we focus a little bit more on critical care training. You'll have 2 months of trauma and surgical ICU, a month down in the PEDS ICU. That's balanced by months of EMS and toxicology, which tend to be a little bit lighter. You'll do some time in community emergency medicine at Taylor Hospital, and then 6 months of emergency medicine at Crozer. We also have some elective time built into the second year, and that's an opportunity for folks to explore areas that they want additional training and experience in. For instance, pediatric anesthesia or radiology, orthopedics, ophthalmology, different areas like that. In the PGY 3 year, we also have some elective time, and that's usually an opportunity for residents to explore things they may be considering for fellowship, such as a toxicology rotation. We've had a resident want more experience doing ultrasound guided nerve blocks, things that are a little bit more advanced, and perhaps international experience as well. You'll rotate in the burn ICU. You'll do some time in ED administration, focusing on various committee meetings, QI conferences, that sort of thing. A month of pediatric emergency medicine, and then the remainder of your time in the emergency department. We don't have a specific teaching block. However, during your emergency medicine months, you will have various shifts assigned to you that are teaching shifts. You'll be an extra third year there who's really responsible for helping some of the medical students, off-service learners, as they navigate their rotation experience. You'll be involved teaching didactics and running simulation sessions as well. So again, I think that we provide an outstanding clinical and educational experience to our residents. You can see some pictures here because it's not just in the emergency department. Really, you'll get awesome experience in training outside of the emergency department as well. We have our conference every Wednesday morning. This is protected time from 8:30 a.m. until 12:30 p.m. Traditionally, we would do it in person. However, with COVID, we've switched primarily to a virtual format. We use Microsoft Teams, and overall, it's been working pretty well. I think folks miss a little bit of the camaraderie, but there are certain advantages to doing it online as well. And so all in all, it's been a pretty successful shift to the virtual format. We divide our content into blocks, and then within each block, different subjects are taught in different modalities. So some blocks may have more simulation, other blocks may have some task trainers and practical things. Other blocks may be small group materials or primarily lecture format. But various attendings spearhead each block and develop the curriculum. Our attending Dr. DeStefano runs the overall conference schedule, and he's also in charge of incorporating the Foundations of Emergency Medicine, which is a case-based didactic series that we incorporate as part of conference. We also use Roche Review for our asynchronous learning to help reinforce some of the content areas that are discussed in conference, as well as to provide specific guidance and feedback regarding board preparation. We hold a joint conferences with other programs within the institution, for instance, trauma conference or joint pediatrics conference, several times a quarter. We also have GME-based conferences where all of the residents from the institution gather monthly to discuss topics in common to all residency programs, for instance, duty hours issues and wellness issues, virtual learning and how to use the internet and research and sort of common themes throughout all residency programs. We also gather as an EM community in the Philadelphia area and participate in citywide conferences. There's probably 5 or 6 of them scattered throughout the year. The first Wednesday of every month, we have our journal club. It's an informal way to get together, to socialize, and to discuss articles within a certain content area. We usually use a mix of classic and cutting-edge articles, have residents assigned to present them, and then we talk about them, pick through them, and really try to focus on whether or not it would change our practice, and if so, how. We tend to do it at a faculty member's house, a bar, or a restaurant. With COVID, we have also switched to doing this in the virtual format, but we are trying to switch back to do it in person again. Following Journal Club, the residents have protected time for Resident Night Out with various events and things that they do that's organized by the residents. This is social. They might continue staying at the bar or restaurant. They might go bowling or do some other sort of group activity. But it's a great time for folks to get off and to hang out together. In emergency medicine, the ED is open 24/7, 365, and so it's difficult for the residents to get together and develop a sense of community because of that. But this goes a long way towards helping them do that. We also have a resident wellness day in the spring where all the residents are relieved from clinical duties. Again, an opportunity for them to hang out and socialize as a large group. They've gone to the beach, they've gone whitewater rafting, various local trips, and other activities. One of our hospitals is attached to a YMCA, and we give all the residents a membership to the Y that they're able to take advantage of. We give generous protected time, such as resident night out, wellness day, but also various times throughout the year to give them off for social activities and other wellness activities. All the residents are enrolled in AEM, ASEP, and EMRA, and they attend a conference every year. Again, this year with virtual conferences, it's a little bit different, but generally the residents attend ASEP, which is held in the fall, and is a good opportunity for networking and to find out about job prospects and that sort of thing. And here are our residents. You can see the list of where folks are from. I feel like it's a great mix of folks from the area, but also folks from all over the country and various places and prior levels of experience and training. And here you can see our graduates, very proud of them. Our first class is on the top and the second class is down there on the bottom. And again, our graduates have gone to a wide variety of different places, fellowships, into academic teaching positions, into community positions across the country. And you can see the various locations and spots that they ended up. But not to worry, we still have some outstanding residents in the program, and really great people and really nice. I hope that you'll get to know them a little bit. One of the difficulties of doing virtual interviews is that we won't be having night before get-togethers where you can really get to know folks. You won't be hanging out during the interview day, getting to know folks. But I hope that by using the website and looking around, that you'll get at least some opportunity to meet people virtually and to get to know them a little bit. We also have some great faculty. And again, same thing. It's very difficult in the virtual format for you to be able to get to know folks, but really proud of the faculty that we've been able to put together. And it's just a really great, fun place to work. And that extends to the nursing staff, to the respiratory therapist, to transport, to everybody top to bottom. One of the really great things about our department is how much teamwork is involved and how much overlap there is. We all do everyone else's job, and whatever it needs to be done to take care of patients is what folks will do to help take care of patients. It's a very supportive, friendly, communal, and community environment. One of the things I love about our department is kind of summed up in the picture of Sylvester Stallone there. They filmed part of Creed in our department, and what that picture encapsulates is that sort of teamwork and esprit de corps. There's nurses, housekeepers, phlebotomists, there's a transport tech in there, and you can't tell who is who by looking at that picture, and that's truly the case when you're working in the department. It's a very collaborative and enjoyable place to work. For those of you that are from Philadelphia, you know that Delco is its own place. Across the country, Delco is its own place. We have a very distinct personality and a real sense of home and place that is different from Philadelphia. We are just southwest of Philadelphia. There's about 600,000 people that live in the area, and if you haven't heard of Delco, you probably have heard of Haverford, Villanova, Swarthmore. These are college towns within our community. Widener is a college just across the street from our hospital. It's they have many allied health and other training programs, and so you'll see lots of Widener nursing students and allied health students, physical therapy, occupational health therapy, that sort of thing, in and around the hospital. Philly is a great sports town. We are passionate about our sports teams. Unfortunately, our sports teams are not always living up to the passion that we have for them, but really a great place to be if you're into sports and similar activities. We have great outdoor recreation nearby as well for an urban area. There's great parks and trails and other sort of outdoor activities nearby. And so here you can get a sense of our area. Our hospital is down here along the highway. Most of our residents live in the city of Philadelphia. It's about 15 or 20 minutes away, depending on what time you're traveling and how you're traveling. Most of the attendings tend to live in some of the communities in Delaware County, but a decent number live in Philadelphia. A couple live in New Jersey. I think there's many benefits to being a resident at Crozer. I talked about the YMCA a little bit, and that's really an interesting and great opportunity for residents to be able to go to the Y free of charge. We have a pretty competitive salary and a very liberal educational stipend. You can use that to pay for things like your USMLE, Step 3, books, different electronics, computers, that sort of thing can all be paid for by the educational stipend. It's $1,800 per year. The remainder of the benefits are very similar and competitive probably to most other places, but if you want more information, you can definitely look for some specifics on the website. All right, so in closing, we are a young and dynamic program. I truly feel that there's nowhere else that you will be able to make a difference and impact the course of your training than you will be able to at Crozer. We are very responsive. We're young. We're growing, and we're really trying to determine the best way that each individual resident will get through residency. And I promise there's not another program where you will be able to impact the course of your training like you will be able to with us at Crozer. And so I'd love to open it up to questions. I'd love to have just an informal conversation and see what's on your mind. It's very difficult to do in this format, but if you have any questions, please reach out to me, send me an email, and I'll be happy to continue the conversation. So, all right. Well, thanks for watching, and I hope to meet and speak with everybody in person.